Hello guys, it's Road Does Politics, back with another video. Today we're going to be talking about the obvious coronavirus that is sweeping the globe as we speak. Thousands and thousands of people have now tested positive across the world. Quite a few thousand have died already. It is a serious medical health issue, but I myself aren't panicking at the moment, because I'm a fairly young, healthy person, and experts have told us that really the fatalities only really occur in those with underlying health conditions, the old and the sick. Those are the people that are more likely to develop more serious symptoms, respiratory, breathing problems, pneumonia-like symptoms, and subsequently die. So there's a lot going on in terms of government shutdowns, nationwide shutdowns of different states, different countries around the world. As you probably know, it started off in China, in Wuhan, sort of around Christmas time. Tried to contain it, couldn't be done. Lots of movement of people flying everywhere, to Europe, to America, across Asia. Obviously, people carrying this virus not displaying symptoms until they actually reach their destination and then start spreading it there as well. So, it's now been declared by many countries, and including the World Health Organization, as a pandemic. So pretty serious stuff. So as we speak, I'm going to read some stats to you, if I can. On the Guardian website, as of 3:10 today, total UK cases of the coronavirus, 797. New UK cases, 207. Total UK deaths is 10, but that might have gone up. So yeah, it is quite serious. I'll show you a quick clip of, if I can, of I was in Tesco earlier, and there were literally no toilet rolls. Well, there were some, which I managed to get one pack of because I just needed some. But everyone is panic buying toilet rolls for some reason. If someone can explain that, you'd be very welcome. But yeah, people are just going crazy with panic buying. I understand if people panic bought hand sanitizer, which they are, and soap, which they are, and canned and dried foods, which are still readily available. But toilet roll? Make a sort of toilet roll shaped sort of barricade yourself in your house for 14 days and don't go outside, perhaps. But yeah, so the UK government, as of now, have sort of done a U-turn, whereby on Thursday they weren't declaring any sort of mass shutdown or social gathering bannings, but now they've said that they are going to have social gathering, ban social gatherings, basically. So people have, I don't know how many, like up to 500. I know Scotland have said that they're going to, but their previous method of trying to delay this virus, that they've got like these stages of contain, delay, something, but they were trying to explain about this herd immunity process that they're trying to implement, whereby they want as many people as possible to actually catch this disease, so that by the summer or by the winter, most 80% of the population will have had it, and therefore won't put as much pressure on the NHS in wintertime if it comes back again. So instead of the virus peaking like this, it will sort of peak like that, sort of like a sombrero, the way that they were describing it, sort of flattening the curve, as it were. But they've since now backtracked on that and have decided, like many other countries, to take this more seriously and actually follow experts' advice by banning large meetings and sporting events, etc., which sounds much more sensible. So BBC website says 10 more people have died in the UK, bringing the total number of deaths to 21. All patients were in at-risk groups, making them more vulnerable to the effects of the virus. So the chief medical officer, who's Chris Whitty, said that. And as you probably are aware, this is going to place a massive, massive, massive strain on the NHS. I feel sorry for people in America who do not have a socialised health system. And luckily, I mean, I think pressure's been put on Trump to actually fucking do something about this. But as usual, he makes everything about himself, and everything's to do with the stock market, not about the actual health of people. But he's sort of been forced to sort of implement sort of health packages and things, and sort out things with insurance companies, etc., to actually make sure that they've not even sent out test kits for people to make sure they can get tested if they think they have it. God, this really shows people, like, it's so revealing about, you know, governments and countries and whether or not they actually give a shit about the people that they have been elected to govern for. It really is, it's so revealing. Ridiculous scenes in London supermarket. Photos of empty shelves in the UK. The US and Australia have become commonplace in recent days because of everyone stockpiling up on loo roll. UK flights to Spain turn back. Flight cancellations. Netherlands, number of cases there rise to 959. Although the Japanese PM says the Olympics will go ahead. African countries have reported new cases. Oh my goodness me, Africa won't be able to handle that. Spain has reported 1,500 new cases and 15 deaths since early Friday evening, and Easter processions in the country have been cancelled. So yeah, pretty serious stuff. Quite a lot of, like, I think the global death rate is now at probably close to about 5,000, I think, from when I last looked at the stats. But a lot more have contracted the virus. I mean, you are able to recover from this. Lots of people like to compare this to flu, only that the reason why people are taking this so seriously is because there is no vaccine for this, and it's not really treatable in that case. So if you're old, if you're sick, if you've got underlying health conditions, if you're taking immunosuppressant tablets, you're a lot more susceptible to things like this getting in your system. And, you know, there's a worry that, you know, people who do get this, who are, you know, struggling health-wise, will, you know, suffer fatalities. So that's the state at the moment. I so far have not been self-quarantining. I feel fine currently. I've got no symptoms of any sort of flu-like respiratory symptoms. But I don't know what it will mean for sort of going out to public places, things like libraries where I work, you know, shops, retail, restaurants, pubs, things like that. Sporting events, I know that they're closing down at least until April. But we're just gonna have to wait and see how the government reacts and responds to this. Will they be sort of getting the police or the military involved? Because we just don't know how it's going to spread. Like, it's all very well anticipating, but, you know, viruses, diseases, they don't care if you're rich, they don't care if you're poor, they don't care if you're upper class, middle class, working class. They don't care if you've got a fancy car. They don't care if you live in a squat. They don't care if you live in a castle. It's going to find you, and, you know, at some point you're going to contract it. Just like one of the health ministers, Nadine Dorries, ended up catching it and then passing it on to her mother. So I don't know whether that's karma for you or just bad luck. I hope that they recover, but, you know, I think really this Tory government are finally beginning to grasp how serious this is, because it's affecting them as well. So, you know, gone is the I'm alright Jack attitude, fuck everyone else. It's going to get you lot too. So, you know, prepare yourself. This disease takes no prisoners. You know, not even Tory voters are safe. Just saying. Just saying. Right. So if you've got any comments, questions, as usual, post them down in the comments box. Hopefully I will not have to self-quarantine, but if I do self-quarantine, it will be a good opportunity to do some more YouTube posts. So that's it from me for the moment. See you guys soon.